Hey everyone, C Money RN here. Welcome to a brand new episode of my YouTube channel. If you're new to this channel, my name is Christian. I'm a registered nurse based in Las Vegas, Nevada, and I love to make videos about my favorite subject, nursing. So if you're interested in pursuing the nursing field or the medical field in general, this is the right channel for you. In today's episode, we're going to be talking about everyone's favorite subject, the coronavirus. Welcome to the episode. Alright, so before I begin, guys, I want to talk about something that just happened to me recently. And if you've been following me on social media, whether it be Instagram or Facebook, you'll know that I just got accepted into FNP school. And this has been a goal of mine ever since I pursued my bachelor's in science of nursing. And I knew for a fact that I wanted to pursue higher education. So, super stoked. I start FNP school in fall, and that means more student loans, more papers, more research, but I am ready to go and I am super excited to start this new journey. I'll be sure to document from the very beginning when I start my FNP school program to the very end, so expect to see a series in my YouTube channel, everyone, about the pursuit of an FNP, so I'll provide some perspectives on how to approach an FNP. So let's get into today's topic, which is the coronavirus. Now, by now, guys, the coronavirus is something that you should have a general understanding of, where it came from, how it spread. So I'm not going to spend this entire video going all over basis of coronavirus, but rather I want to talk about it from the perspective of a frontline worker like myself on ways how you, the general public, can do to reduce the spread and transmission of coronavirus, and what are healthcare workers like myself doing at the hospital setting to protect ourselves from contracting coronavirus. And at the very end of this video, I want to also talk about what are some tips and tricks on how to approach these coronavirus patients, whether it be a patient that we're trying to rule out or a patient that's positive for coronavirus. So we're going to get right into the nitty-gritty of it, and let's begin with part A, which is talking about how you, the general public, can prevent the spread and transmission of coronavirus. Now, if you've been following the CDC lately, the CDC has been recommending cloth masks when going out in public. Now, cloth masks may sound like a bad idea, but you also have to understand the reason behind it. Now, cloth masks, or masks in general, the purpose of it is not to protect you from contracting coronavirus, but it's to protect the population. Now, let's say, for instance, if you knowingly or unknowingly have contracted the coronavirus, the purpose of wearing a mask is to prevent the spread of it. Coughing, sneezing, it has a continuous face covering over your mouth, so it prevents the possible transmission from going from point A to point B. That's the purpose of wearing the mask. Now, why cloth masks? Well, cloth in general is easily accessible. You can make cloth masks out of your old t-shirts, out of towels. But the purpose of using cloth masks in particular is to help save supplies and equipment for us healthcare workers in the hospital setting, because as you know, we are super short. We don't have enough surgical masks, we don't have enough N95 respirators to go around, so that's why the CDC currently recommends that you make a cloth mask or obtain one while going out in public and keeping your face covered at all times. Now, in addition to wearing face coverings, what's also recommended, everyone, is that you practice good hand hygiene. Now, when I'm talking about good hand hygiene, I'm talking about spending 20 seconds, I'll show you guys, washing your hands, singing happy birthday as you go along, happy birthday to you, pretend that's 20 seconds, scrubbing in between your fingers, scrubbing right underneath the nails, really good for 20 seconds, and the purpose of that, everyone, is to keep your hands clean. Every time you touch a high surface, high touch objects such as your cell phones, surfaces, computers, light switches, faucets, you always want to keep your hands clean at all times. Because unexpectedly, you may touch a surface and you might accidentally scratch your nose, scratch your eyes, scratch your mouth, and that's how the coronavirus is spread, through contact. When one person sneezes, they touch an object, and when another person touches the object, then they get the coronavirus themselves. So you gotta be sure to practice good hand hygiene. Besides hand hygiene, it's also to respect the concept of social distancing. Now, social distancing, the minimum is 6 feet apart, and the purpose of social distancing is to help prevent the spread and also being very up and close from a person that may very well have coronavirus. So by social distancing, you're keeping a safe distance, a respectable distance, and you're also preventing the spread of it that way. Alright, so now let's get into part 2. What do healthcare professionals do to prevent the transmission of coronavirus, and how do we protect ourselves from contracting it? Well, the bottom line, everyone, is that you need to wear proper protective equipment. And by protective equipment, you don't wear a surgical mask when going into a patient's room. Rather, what you should be wearing when you're going into a patient's room that may have coronavirus is an N95 respirator, gown, gloves, and a face shield. That is the gold standard. The alternative to an N95 respirator is something called a PAPR, which stands for a Powered Air Purified Respirator. And as you can see in this video, guys, I'm demonstrating the proper way of putting on this equipment. You first put on the mask, you put on the gown, you put on the gloves, and it is a step-by-step process. It takes time putting on all this equipment, whether it be wearing the PAPR or whether it be wearing an N95 respirator. It takes time, and you want to make sure that you're protecting yourself completely before going in and out of a patient's room. So the Powered Air Purified Respirator provides positive airflow, filtering out all the contaminants in the air, and uses a battery-powered blower to provide the user with clean air through a hood or helmet. So whether it be the PAPR or the N95, both are appropriate equipment when working with coronavirus patients. Now, after you go into the patient's room, it's also very important that you spend the same amount of time as you were putting on that equipment to taking it off and cleaning it. This is very important because if you think about it, you're not the only person that's using this equipment. There's also respiratory therapists, there's doctors that go in and out of the patient's room. So you want to spend a good amount of time cleaning this equipment. And in this clip I'm going to show you is how much time I allot myself to cleaning the equipment, whether it be wiping down the face shields, wiping down the PAPR machine itself, the tubing. I spend a good amount of time doing this so I can prevent the spread of coronavirus, because the PAPR itself, the N95, all the equipment, gown, gloves, and everything are considered surfaces, so you want to make sure that you remove it properly, that you clean the proper equipment so you prevent the spread from one person to another. And last but not least, guys, here's some tips on working with COVID patients. Now, number one, when you're working with COVID patients, it's important that you go into that room with a sense of empathy. You got to put yourself in their shoes. If you think about it, not only are visitors not allowed from coming into the hospital, but there's also a limited number of people that can go in and out of the room. So with this limited contact, patients get very lonely. So it's very important that you spend enough time talking to your patients, getting to know them as if they were a regular patient, and just help them feel comfortable, because it's not fun enough being stuck in a hospital, but it's also not fun being stuck and confined in a room that you can't even leave to go to the hospital floor and walk around. You're stuck in a room 24/7 until you test negative. So try to put yourselves in their shoes. And number two, another tip that I have for you guys when dealing with coronavirus patients is to establish a plan of action from the get-go. Help your patients understand that as the nurse, as the RT, as the doctor, it's very difficult from going in and out of the room frequently. So if there's anything that they need, try to help your patient communicate with you exactly what they need before going into the room and before leaving the room. Before I go in and give my patients their medications, I call their room phone and I ask them, I say, hey, listen, I'm about to come in to give your medications. Is there anything that you need? And most of the time they'll tell me they need some extra water, needing extra blankets. So if you can gather all those equipments from the get-go, in addition to your medications, or even with their breakfast, lunch, and dinner trays, you're eliminating the number of times you're going in and out of that patient's room, and also the likelihood of them using their call light. Because when they use their call light, very likely it's because they need something. So if you can address it before they have the chance to remind you to do so, you're saving yourself some time, and also you're saving your patients some time as well. And number three, not all patients are going to be awake alert oriented. Not all patients are able to help clean up after themselves or feed themselves. So it's very important that you spend the amount of time going into the rooms, helping the patient eat, helping them meet their nutritional goals, and help keeping them clean, whether it be changing their bed linens, their pillow sheets, changing their dressings. You want to spend enough time doing so, because as the coronavirus nurse, you're the only person that's allowed to go in there and take care of the majority of their needs. The respiratory therapist will treat them from a respiratory breathing standpoint. The doctors will go in there briefly to communicate orders. But as the nurse, when you're going in and out of the room, it's very important that you spend enough time addressing this, so it helps keep the patient safe and also even help put family members at ease. It's very important too that if your patients have loved ones, those that are not allowed to go in and out of the hospital, that you also make an effort to explain and give updates on their loved ones, whether it be what's going on, what's the plan of care, so then that way you're also putting their anxieties at ease. And as long as you communicate that frequently, you're not going to get a 11 o'clock p.m. or a 7 a.m. call in the morning saying, what's going on? I know for a fact if I had a loved one staying in the hospital setting, I want to know what's going on. I'm not even allowed to go in the hospital, so it's very important that I get those updates. Alright guys, so that's it for today's episode. Hope you found all these tips and tricks helpful. If you have any suggestions on what I should talk about in future videos, please leave a comment below. And if you enjoyed this video, please go ahead and hit that like button, subscribe to my channel if you haven't yet, and I hope you guys enjoy future content of my nursing channel. Thank you guys so much for watching. Take care.
Bustling through the bears that try to contain me. Moving on up, making moves of money endlessly. How you think I got this name? C Money, it's my specialty.